this is Carla with Intuitive Spirit Healing Arts. Today we are talking about how to relieve growing pains in children. So just as I promised, the other day I did a kind of prequel for those who would like to join us today. And so I hope you got everything that you need. As a reminder, you will need some oil or lotion, a towel to protect whatever you're using at the moment, and of course your child, your little one. And that way you can practice with us today. And I have my little helper. He's a big boy now, but this is my son Caden, and he's going to assist us today. So I will be doing sample massages on him. And like I said the other day, that if you are doing it with us and maybe you didn't catch something, or you had a question that pertains to what we're doing in the moment, we can go over that in the moment. Otherwise, you can always review this because it is recorded and try it. But I will say that the best time, once you get a handle of the flow that we're going to do today, the best time to do this is at night, just before bedtime with your little ones. And so we're going to discuss that. So we're going to talk about what growing pains is, what it isn't, some things to complement the massage and body work that we're going to do today, and some other things for you to think about as you're doing this. Sometimes you may see me kind of refer to some things, and that's just so I can make sure that I have all the information ready for you. Okay, so let's see. Sorry. Okay, so again, like I said, Caden's going to be helping us. He's going to chime in at times. And so let's just jump right into what is growing pains. So basically, growing pains happens in childhood, and it usually happens with children between the ages of 3 and 18. However, the age group that complains about it the most would be around age 5 to 14. So they're the ones who will more likely come to you and say, "Oh, mommy, my legs ache," or they hurt. And usually with growing pains, it happens at night. And I do stress that because if your child is complaining about leg pains during the day or at any other time, you may want to ask them a little more questions about what is going on, because it could be something else that's not quote unquote growing pains. So, and we'll get in a little bit of that as well. So basically growing pains happens in the legs, usually between the hips down to the ankles. Sometimes with most children, happens in the feet as well at the same time. They can be achy between, usually in the front of the legs, on the side, or on the back, or all around. So it really depends on the child. Sometimes they have them in both legs, and sometimes just one. Okay, so the other thing I wanted to talk about are the symptoms. And what better person to ask than a child who's been through it? Because honestly, I have to admit, I don't really remember growing up having them. So I don't really know what they feel like. Although by the time I became a mom and a massage therapist, I began to realize that not only does it affect boys, but girls go through it too. And when I was writing the article on my blog about it, I also asked my son, well, exactly where do you feel the pain, or what exactly does it feel like? And I think we're going to take that time to find out from him. So, Caden, when you experienced growing pain, can you explain to everyone exactly what it felt like for you?
It felt achy, and it was like a sharp pain. Sometimes it would pulse, like when I didn't touch it or anything, I just let it lay there, and that didn't feel good. I don't remember much from it because it was a long time ago. But I do remember it hurting like really bad.
And where would you mostly feel the pain or the pulsating?
It would usually come from my thigh and then would go down to my ankles.
Okay. And would you say that most of the time it's in the back of your legs, or on the side, or on the front, or sometimes it just varies?
Sometimes both in the back and the front.
Okay.
Not usually the sides.
Oh, okay. Okay, that's good to know. So these are questions that you could ask your child too. What does it feel like? You know, and just kind of try to interpret the language that they're capable of using. Where does it hurt? How much does it hurt? So that you can have a better idea to know exactly what's going on. And again, as I said, if in case it's something more serious. Okay, so just to reiterate what Kaden was saying, it can be mild to intense sensation in the legs, throbbing, achy, painful. Some kids may even use the term sharp pain. I think Kaden used that. And if they are using the language of sharp pain, make sure you probe a little bit more, because this is what you want to make sure it is not. You want to make sure that it's not a broken bone, a fracture, a twist or sprain, swelling or inflammation, or any kind of major illness. Because as you know, I'm sure most of you have had the flu before. Sometimes certain illnesses will make our bodies feel achy. And the flu can do that as well. So they're feeling achiness in their legs, usually throughout the day. Again, maybe it will worsen at night, but mainly throughout the day. But if it's accompanied by achy feeling in the back, or headaches, or all over, then you may want to take your child to the physician just to make sure that it's not the flu or any other kind of illnesses. If it is a breakage or a fracture or swelling, you may want to take your child to the hospital right away or to their pediatrician just to make sure it's not anything worse that could be taken care of in the moment. Okay, so that's really key to consider. Okay, so let's see. Let's also talk about, just so you can have a better idea, what growing pains is not. Okay, so unlike the term growing pains, there hasn't been any medical or scientific evidence to really say that growing pains is due to the child or person growing or having growing spurts. More likely it was coined that terminology because there were a lot of children complaining about having sensations in childhood, so what better name to give it than growing pains? From my observation and a lot of other, not other because I'm not a doctor, but from doctors' observations, more likely growing pains come from children just everyday play. And sometimes they play hard. They love to jump. If you ever seen them jump, they don't jump soft like toe heel. They bam, and that sends a shock wave up the leg into the bone. They love to run hard. Sometimes they're banging their legs into different things, sometimes into each other. They love to fall. So that hard play, by the time it's bedtime and the child begins to settle down, and that communication, okay, it's rest time, that's when they start to feel it the most. That's when they start to feel the reverberation of that hard play. So more likely that is what growing pains is. Okay. The other thing is some complementary things that you can do in combination to what I'm going to show you today. So around nighttime, it's great to prepare your little one for the massage. Maybe, especially if they have a bath time. But if they don't, get in the habit of giving them a nice bath time, because the warm water actually helps to relieve any kind of muscle spasms that are happening in the legs. It helps to relax the system. It helps to relax them. And you can add to the bath water lavender bath salts. You can also add magnesium flakes. Just make sure that whatever you get is child friendly, because you don't want to bring any kind of harm or anything to their skin. But you can add that to their bath water and just let them soak for a little bit. Just, don't make the bath water too hot, but warm enough that everything just begins to melt. Everything, meaning that the enhancing relaxation and just really getting the soreness out of the muscles. Okay. The other thing, make sure they have nice, clean pajamas. And then as they're taking their bath, you want to get your things ready. So like I mentioned in the prequel, make sure you have your oils. So for oils, you could use olive oil. You could use coconut oil. You can add essential oils to that, like lavender. You could also use arnica. Arnica is really great for muscle tension. And if you have calendula in the house, you could use that. There are also creams and lotions that you could use as well. So if you go onto my blog and look up Lovingly Combating Growing Pains, I do have some ideas on what you can purchase to assist your child in relieving those pains in their legs. Okay. Also, if you have any other questions, you can always contact me. I would love to answer anything. Just going to take a quiet pause for just a moment. I have you to close it up. Okay. Okay, so to continue, so you'll have give your child a nice warm bath at night. You have your oils. Also include a towel on the bed, because you don't want to, if you are using oils, you don't want to get that oil stain on the bed because it's really hard to get off, okay? And then you have your little one. Okay, so I'm going to have Keaton lay down on his back. All right. Okay, and straighten out your legs. Also, before we get started, I do need to give a bit of a disclosure, because it is really important. Just a reminder, I am a licensed massage therapist, but I'm offering this information to you as parents for your personal use. So this is in any way for a massage credit or to go out and do massage professionally or for money. If you are interested in being able to do that, there are a lot of great programs around the country that will give you the proper training. And after you get that training, you also want to make sure that you are complying with your state's license law for massage therapy, because it's very important to keep the people that you're working with safe. Okay. I also want to make sure that you understand that if your child has anything that you're not sure that massage is going to be beneficial for, just check in with their doctor just to make sure before you get started. Even as adults, we always want to ask that so that you're not bringing more harm. You want to bring good and healing to the person you're working with. So just as a reminder to that, okay? Let's get started. All right, so I got Keaton here, my big boy helper. I'm pretty much gonna work on this leg here so that you can see. Now, I don't have a cameraman, so I don't have anyone to pan in different directions. So like I said, if you do have any questions or need any kind of verifications, we have another tablet over here so if you have any questions, we can look at that, take that, and reiterate anything. Or you can go onto the blog and get a little bit more detail, or you can contact me, and I would love to share any information that will help you do the best that you can, okay? So today, I am using coconut oil on Kaden. So you'll see me using that. So I want to start off by also just kind of reconnecting. So the leg area of your child, this is where we're going to be working from the hip socket area here all the way down to the bottom of the feet, okay? So also for some children, we have I'm sure you've heard the term IT band, and sometimes that can be a little tight, so we'll address that. And also on the sides of the legs as well. And the techniques that we'll be doing are basic massage. We'll also be incorporating some Thai massage techniques as well as integrated positional therapy. And if you want to know more about those individual bodywork techniques, I will have those posted on my blog, which is ishealinglife.com or ishealinglife.com. I don't quite have those posted yet. The integrated positional therapy is coming very, very soon. And then I'll have Thai massage after that. Okay? So we're working with the leg from the hip area down to the bottom of the feet. The techniques that we'll be using, and I will give you the professional terms as well as the layman terms, but we'll be doing effleurage or gliding techniques. We'll also be doing petrissage or kneading, some lifting, as well as trigger points, okay? So as you're doing the massage, you want to keep in mind, you don't want to use very, very firm pressure on children because their muscles, their bones, their skin is a little more sensitive than an adult's. So you want to check in with them. You want to kind of start in slowly. And if they're going, ow, ow, mommy, that hurts, or daddy, that hurts, then back off, okay? Go in a little bit slow until it's comfortable for them. And usually when you're tapping in, when your mind isn't on other things, you can pretty much gauge the pressure that you need to use for them, okay? Now, Kaden is a little older. I could use a little bit more pressure than if he was 3 years old or even 5 years old, okay? All right, so again, we're going to be using some effleurage, we're going to be using some petrissage, and some trigger points, and then some movement, what we do in Thai, as well as some positional therapy, which is putting the body in a comfortable place in order to release the muscles, okay? So the very first thing, so you'll understand the first two terminology, I'm going to demonstrate those specifically, okay? So let's start with the effleurage, and I'm going to be coming around my table a little bit too. So the effleurage, I'm getting me a little bit of oil here. I'm going to warm my hands up as well. So the effleurage is a gliding motion, okay? Now to start off, this is my intro. This is my what's going on. Can I feel any tight muscles here? And I'm going to start at the ankle. So you can see me. I'm going to start at the ankle. And I'm going to move up to the thigh area and then come down again. So this is my effleurage, okay? And off the feet. When I move up, I'm moving circulation up to the heart. And here, it's just a way for me to start over again. Okay, get a little bit more oil. So we're doing our effleurage. Sometimes just this right here will help to relax and make and help the legs to feel better. Okay, now coming here. The other thing that we're going to do is the petrissage. It's easier to do at the thighs because there's more to work with here, but you can also do it on the lower legs as well as on the feet. So basically it's just squeezing and manipulating, okay? So here you'll see me petrissaging, okay? It's really nice, like just above the knee when they get that achy feeling. That helps to soothe that. You can also lift. Okay, so this is petrissaging. This is what it looks like on the lower leg here. And just keep in mind, I'm back here, I'm using my massage table, but just so that you can see. But you can do this if they're laying in their bed and maybe their bed is up against the wall. Don't feel like, oh, I can't do this because I don't have a massage table or I can't get on the other side of the bed. You can actually do this by facing this way or have them turn around so you can do the other leg. And you can do the same thing facing them. So if this is facing, I can do the same thing, okay? All right, so those are your two major techniques we're going to be using to help soothe those painful legs. And I'm just going to, here's the flow. Okay, we're going to start right in on the flow. Okay, so we are effleuraging up and coming down. This is my intro. Okay, and I'm just going to do one more flow. You do this as many times as you feel is appropriate. Okay, and now my focus is going to go onto the thigh area, and then I'm going to work my way down to the feet. Okay, just going to lift this up just a little bit. Okay, so with the effleurage, I'm just going to focus on the thigh. And the other thing I can do with here, I'm just going to take this leg so you can see, is I can bring my hands into like a blade position and use this part of my hand and right above the knee, start here and just make my way up to about here, okay? So I'm just going to put a little bit of pressure and then just flow upwards, okay? And I'm flowing up towards the heart, okay? I can bring this movement more to the side, or about 45 degrees on the leg, here. I can also bring it directly on the side. And then just on the inside of the leg, this is the knee here, just here. And remember, this is a child. You don't want to go too far up, just enough to release any aches and pains. Okay. I also want to note, there are times when you will be lifting the leg. The major thing you want to be mindful of is that when you lift the leg, don't let the knee drop. Okay, so this is the knee, don't let it drop, because the knee is a very sensitive space. Okay, so anytime when you're moving your child's leg, you want to grab up under the knee and just kind of move them around. Okay, if you're doing a technique where you need to have it up, hold behind the knee, and then I can do this as well. Okay, all right. And then if you're sitting, what I tend to do, this is a little bit of Thai massage movement. I can make sure that his knee is protected by bringing my knee under. And then I'm going to take my hands, hold the thigh here, use my thumbs here, and just petrissage. Okay. I can also do one thumb and just make circles. Then you see my body's moving a little bit. This way I'm incorporating my whole body so that my arms or my thumb isn't getting tired. And I can make sure that I complete my circles because I'm not tired. I'm using my whole body. Okay. You can bring that above the leg. You can see that. Okay. And then if you were on the inside, right around here, same thing with the thumb. Okay. Then I can do some squeezes. Squeezes are always nice. What we call, this isn't necessarily compression. This is more a type of petrissage. And I can squeeze the top. And like I said, Caden's a little bit older, so I could use a little more pressure than I would with a 3-year-old or even a 5-year-old, okay? With the squeeze-in motion, lifting the muscles away from the bone. Okay, cool. All right, now I'm going to come down a little bit more. We got the knee area right in here on the thigh, kind of on the bottom of the thigh. Always be mindful, don't manipulate the patella or the kneecap here. But we're going to go into this little soft space here. You can take your thumbs, put them together like this, and then bring in a little bit of compression down and then up, like up towards the pelvis. Okay, but don't move it, just keep it in that spot. Okay, so again, I come down and then up. And I can hold it there for just a little bit. For you, you can breathe deep and just relax as you do this. Your relaxation actually translates to them. When you're nice and relaxed, they become nice and relaxed. When they hear you breathing, they begin to breathe on this kind of the same wavelength, and then they start to relax. Okay, so let me just do this one again. I'm going to press gently and come in and then up. Okay, then also you can kind of do an alternate where you're moving up right around the knees, inside as well. Just be mindful of your pressure, not too firm. Okay, cool. All right, and with a little bit of effleurage, and then we're going to move down. Okay, all right, so we're working on the lower part of the leg right now. Get some of my oil here. And I'm just going to stand up so you can see this a little bit better. Me sitting down kind of blocks the way. Okay, so lower leg, effleurage up. Come down off of the feet. I'm going to do that again. Sometimes what I do is I take my thumbs right above the knee, come down and around, and bring it back. One more time. And down. And just because we're doing a video on this, I'm going to come on this side so you can see me do the petrissage on the low leg. Okay? So I'm just going to go here. And come down towards the ankle. Sometimes right in this little area right here can be a little bit more sensitive, especially in the skin. So just be mindful. Is someone asking a question? Okay. All right. And then you can take one hand, like a puppet hand, right up under the knee, right where the soft part is, and you can just petrissage right in here. And then make your way down. Okay. Again, puppet hands I'm using. And all the way down. There's also, this is a shin. This bone, we call this bone here in layman's terms, the shin. And right on the outside of the leg, there's like a little dip. And if you go on the bone and just kind of drop off just a little bit, you can put a little bit more pressure here and then just take your flow downwards towards the ankle. Or you could use, now I'm only going to do this so you can see it, but you could also do some trigger point. Just press straight down. Press. Okay. Here we go. You just do that several times. And check in. Kaden, how's this feeling? You okay? Mm-hmm. Okay, good.
Feels very massage.
Okay. And now I'm just doing some squeezes. Honestly, if the only thing you have time for when they start complaining about aches and pains in their legs, just squeezing a lot of the times will help to take that sensation away. Okay. Let's just do some squeezes. All right, and that's the foreleg. All right. Now we're going to bring it down to the feet. So right around the ankles, kind of in front of the ankles, is a nice little spot. Remember that thumb thing we did here? We're going to take that movement and see the ankle bones here. I'm just going to twist Caden's leg at the hip so you can see. And you got the two bones, but this part right in here, this little soft part. So we're just going to use that thumb movement right there. A nice little massagey movement. See, I'm still moving my body. See my little, remember I was talking about micro movements in the tension headache video? Micro movements are powerful. Okay, now I'm going to bring that movement up with my thumbs. So on the top of the feet towards the toes and then back down towards the ankles. Come up and then back down and then down. Okay, and then when I come to the top of the toes, again, I'm just going to turn his leg at the hip. And right here, oh, sorry, you can't see. Right here, right on top of the toes, we're going to bring our focus there, okay? So I take my thumbs again and just kind of squeeze downward. So as I'm here, I'm bringing a little bit of pressure and bringing it down towards the ankle. And then I release the pressure, come back up towards the toes and down. Release and down. Okay. And this space in between the big toe and the second toe is a nice space, but don't press too hard there. In acupuncture, this is the part of the liver meridian, and sometimes it can be a very, very, very sensitive area, so don't put a lot of pressure here in this particular flow. Okay. All right. And you can even massage the toes. Give them some little squeezes and massage here. All the way to the baby toe. Good. And then, with my hands here, like this, I'm going to squeeze the feet. I can leave my thumbs on top as I squeeze from this part of the foot all the way to about the ball of the toes. Okay, so squeeze, squeeze, squeeze. Okay, all right. And I'm going to just incorporate another effleurage. This is kind of my way to communicate. Okay. All right. So that's the massage piece. At any point, you know, if you're re-looking at this video, you know, that's definitely a foundation. You have your effleurage, you have your petrissage, you have using your thumbs. That's your baseline. Explore that a little bit more. If the child, if you kind of feel like, okay, it needs to be a little, because I feel some tenseness over here in the leg, then I'm going to stay here a little bit longer until it gets a little bit softer. Okay? If you need to slow down your glide or your effleurage, then take that time. Slow it down a little bit. Maybe bring in a little bit more pressure. Okay? So I'm showing you guidelines, but personalize it to your needs, and especially to your child's needs. Okay, so that is there's a question. Okay, Kaden is keeping up with the questions for me. So let me just pause here for just a moment and just kind of see what you guys are talking about. Okay, so how long would this normally take? Again, it really depends on you guys. It shouldn't take long, like I said. I mean, if you just need to do some squeezes, then that doesn't take long at all. But if you need to do both legs, it may take a little bit longer. And sometimes you'll notice that the child may go to sleep right away. Okay. All right, so that is the massage piece of it. I'm going to lift his leg here. And now I'm going to bring in the other body work, okay? Preferably at this point, the thigh. So thigh massage does a lot of compression, does a lot of movement. It does some positioning too, but it's about the intention at this point, and it also does some stretches, okay? So as I have Caden's leg propped here, I'm going to put my hand just in front of his knee on his foreleg, and then just kind of bring that leg up towards his belly, holding around his heel, and then just kind of press here, okay? And then I can bring it back, and then I can do that again, okay? And just press gently, okay? And then bring it back. The other thing I can do is kind of bring a range of motion, which also helps with circulation, doing circles. And just remember that circle should originate at the hip socket. And then go the opposite direction. I'm going to have him to relax a little bit more and trust mommy. Okay. And then I'm going to bring his leg into a tree posture. Let me just step back so you can see. I have one leg straight and one leg bent here, okay? All right, in this position, I can start to do compression. The compression helps to release any tension, any pain that's going on in the leg. And you've got the hamstrings in the front and the quads in the back. And then what I'm going to do is press directly in the middle, okay? Because this leg is kind of wide. Let me just move this back a little so you can see. Okay? So here, I'm going to take the palm of my hand and just press here. Hold for maybe 3 to 5 seconds. Inhale, move down just a little bit. Exhale, press. Inhale, release. Exhale, press. Okay? And then start again. I come here and move down the leg. And move down again. Okay? One more time. Press here. And I'm right on top of the the leg is out to the side, but right on top of where I'm working. Press completely down, and then come down to the knee. Another really nice thigh move is focusing at the hamstring, and I come just off, or just upwards of the hamstring with the palm of my hand and pressing here as well. So I just did directly middle. Now I'm doing the top of the thigh. Top of the thigh here. And work my way down to the knee. So those of you who are doing this with us, I'm going to do this again. Top here. Nice pressure. Inhale, exhale for you. Again, inhale, exhale, press. And again. This one is a little difficult to demonstrate from this position, and because the way I have the camera. but you could do that with the quads as well. Please be mindful. They are human. Don't go beyond a particular point on your leg. But right where it gets very fatty in the quads, you can take the palm of your hand. Excuse my positioning because just the nature of how we're doing this. But I'm going to take the palm of my hand, keep my thumb close to my fingers, keep my fingers closed, and press into the quads down towards the table or the bed. Okay? And then again. And press. You can use your body weight to come down. But just hold back if you're working on little ones. Okay? Again. Quads down. 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 And make sure you have the belly of the muscle. You don't want to pinch the skin. Okay? You want the belly of the muscle, which is, I guess you can see it right about in here and down. Okay? One more time. Press. Press. Last time. Press. Okay. Nice compressions. And you can do the middle one just for the sake of it. Okay. You can bring that pressing to the foreleg, like right around the calves. And you just press it down. Hopefully you can see that. Press down. All the way down to the ankle. Again, using this part of my hand. And press down. Okay. So just in case if you're just joining us, we are relieving growing pains in children. We're doing that with massage and body work. The body work includes Thai massage and positional therapy. Okay, so we just did compressions along the leg, all the way down from about the hips down to the ankle. And then I'm going to starting at the knee, bring this up. Put the foot on the other side of the other leg, and then just kind of do a counter stretch. So I'm just going to lay that hand here, maybe either hold this leg or I can hold the shoulder, and then just kind of, not too much, just enough. And bring. Okay, just because it's habit for me, I also end with this press as well. Okay, all right. Okay, he's a little bit too relaxed. No such thing as too relaxed. Okay. The next thing, especially when it comes to this part of the leg, we are going to do a positional therapy. Now, if your child is still awake, it does involve their participation. What you can do is bring your fingers up under the heel of the foot, and then use your forearm. And you can hold the ankle about right here. Twist out from your hip, baby. Here. Okay? And then I'm just going to press the toes up towards the body. And then I'm going to ask him, especially if his age is 5 on up, to just press your foot into my arm. You press your foot into my arm. And then just hold that there for about 5 seconds. You inhale, and as you exhale, you say, okay, let go, baby. Relax. Good. Then you want to do, this is integrated positional therapy. This is using a strain, counter strain technique to help fatigue any muscles that's not responding to regular massage. So I'm going to do it again. I'm going to hold his ankle here. All right. Use my forearm at the foot and just press the foot, the whole foot at the ankle towards his body. And then say, okay, use your foot and press into my arm and hold. Inhale for you. And then say, okay, baby, relax. And then have them to relax. Okay? And that's any muscle that's really tight, it's going to fatigue that muscle and have it to let go. And without their participation, you can flex the foot to bring a stretch into the foreleg. And then you can point the toe to kind of counter that stretch as a counter stretch, okay? And then here you can even squeeze the toes a little bit. So I'm going to relax your leg. I'm going to press forward. I can even bring the toes back and then point the toe towards me, okay? And then just do that a little bit. That one you don't have to keep doing over and over again. You could do like 3 sets, okay? And then last time, press. And relax. Good. And squeeze. All right. And just do some last minute squeezes. We're going to do one more thing, and I'm going to have Caden to turn over onto his belly. Okay. So the other issue, and even as an adult, you can do this if you tend to get bad cramps in your calves, especially for those who are runners, but children get them too. So as you'll see in the article that's about to be posted for integrated positional therapy, I talk about how when the muscle is spasming, that's when you get that cramp feeling, or just like this major tightness. When that happens, especially like in the calf, the best way to communicate to that muscle to let go is to shorten the muscle, okay? And the way to do that is actually to bring the leg up. You can even have the child point their toes or not. For some people, that actually makes it worse, so the foot can be nice and relaxed. Nice and relaxed. But when you bring the leg up, it actually shortens the calf muscle, okay? Also from here, you can do your squeezes for the calves. Just really take the belly of the muscle. The calf muscle is actually 2 large muscles, and they separate. Again, I'm going to have him to turn out from the hip. They separate right in the middle, right here. So even though they look like one big muscle, they're actually 2, and sometimes you can just kind of do like a little, that chopping right in here, okay? But coming back to the squeezes, you can just squeeze here. Good. All right. And that's relaxing. And bring it all the way up to where the Achilles is. And just do some nice squeezes in here. Because sometimes the tendons and the ligaments are affected when muscles are spasming or tight. They become tight, or they become a little bit damaged. And so this way you can help to relieve that. Okay. Because tendons and ligaments don't have their own pumping system, they don't get blood as quickly as muscles. Nice gentle massages can help the circulation even in those areas and to help them to heal a lot quicker. Okay. So continuing with the calves, we just did some nice squeezes. Also, if that calf muscle is still pretty tight, and you know, if you touch it, you'll know. You can shorten the muscle by bringing the 2 ends of the muscle closer together. So you just kind of squeeze it in this way, okay? Now, when I work on even adults, runners, yoga practitioners, people who hike a lot, who have calf issues, I've done this before, and you know, with some people, stretching out the foot actually makes it worse. So I had them just kind of lay here and then bring the muscles together. And then in about a few seconds, it starts to release and they can feel that. All right. Just squeeze the calf muscles together. Okay. All right. And then just massage it out. Okay. So, I'm coming back around here. So that's what I have for you today with relieving growing pains with massage and body work. Like I said, if you need reiteration, you could either visit my blog, www.ishealinglife.com or ishealinglife.com. And the name of the article is Lovingly Combating Growing Pains. And I go into some details. I'll also post this video onto there as well on the blog. Or you can contact me if you need some clarifications, or if you're experiencing something else and you need a little bit more guidance. I'll be happy to help you with that.
Can I sit up now?
Can
I sit up?
Oh, yes. Have Kaden sit up. So please contact me if you need to. But hopefully this will help. Just remember the other pointers. A nice warm bath using some magnesium oil or flakes in the bath. You can get lavender to help calm the system.
Question.
Okay, hold on. You can do those things to help complement the massage. So we use the regular massage or Swedish massage, the effleurage or the gliding, the petrissage or the squeezing. We also use some Thai massage, and that's the range of motion. Bring a range of motion as well as some compression to the legs. And we use some positional therapy. That's where we had the participation of the child by pressing their feet into your arms and then releasing, or bringing the 2 points of the muscles together to relax. Kaden says we have a question. Let me just take a quick look.
Should I read it to you?
Not quite yet. I do not have a blanket that you could buy from my store, but that's coming. But in the meantime, also when you start talking about what kind of magnesium oils to get or lotions, inside the blog I have some suggestions that I like to use that I think is really good. So when you go onto the blog, you'll see those. Also, periodically visit the store. I have some wonderful t-shirts, but also keep coming back because I am adding more and more things that will complement how you take care of yourself, whether if it's great resource books. I am looking into having my own lotions, so I have a lavender lotion that you can purchase. And if you'd like to see anything, let me know. Otherwise, I want to thank each and every one of you for joining us today. It's been a pleasure, and I really, really hope that these techniques will help your little ones because they are very, very special. So take care and have a wonderful, wonderful day. Bye.